A sector-wide approach will be adopted to crash down the rate of maternal deaths in Niger State. The Coordinator Minister for Maternal and Neonatal Mortality Reduction, Innovation and Initiatives, MAMI, Dr. Mohammed Ali Pate, Minister of Health and Social Welfare, gave the assurance at the 5-day co-creation workshop of MAMI Niger State implementation held at Husky Luxury Hotel. Zainab Halilukobo has more.
Every 2 minutes, a woman will die somewhere. It's unfortunate that even the Nigeria contributes 30% of the global maternal death, despite being just 2% of the global population. The women are actually dying, in numbers. Pregnancy shouldn't be a death sentence. Every pregnancy must translate to a baby plus X. Along with a few other countries, Nigeria contributes, the most to the global burden of maternal mortality.
With the country's estimated rate of maternal and neonatal death, which stood at 700 women dying in each live birth from complications of pregnancy and childbirth, has informed the launch of maternal and neonatal mortality reduction innovation and initiative known as MAMI. According to Dr. Dare Adenwonjo, the country's lead for MAMI project, said the initiative from the President of the Federal Republic of Nigeria is to reduce maternal mortality, targeting local governments of the state, highlighted the workshop work plan.
We are here, in line with the directive of the coordinating minister, as well as the vision of Mr. President to understand drivers of maternal death and be able to offer solution as a way of crashing maternal mortality and newborn mortality in our dear country. We know this figure or the statistics is totally unacceptable, and so we must do something to ensure that for every pregnant woman, they don't risk their life bringing another life. So for 5 days we'll be here, understanding, going into the community, doing a co-creation workshop or discussion for us to come up with a solution that will be owned by the state, the local government and the community people, as a way to ensure that no woman, dies, bringing another life, and then for the children to see the 5th birthday.
While declaring the workshop open, on behalf of state government, Dr. Ibrahim Ahmed Dagana, Commissioner of Ministry of Primary Healthcare, noted the alarming rate of maternal and neonatal mortality from the statistics that local government contributes most to the rising number. Said the workshop is to look at the key drivers affecting maternal and neonatal in the state. Urged participants to use the knowledge geared toward reducing the scourge.
Our maternal mortality rate mirrors what is happening nationally, which is about 512,000 women dying per annum during the course of delivery. But when you mirror it down to the grassroots, you will have a figure as high as 1,000 in some local government areas. And this is very, very unfortunate. And that's why the government is not sitting down. We have to continuously look for ways to, curtail these unfortunate situations. Most are avoidable death. So the government is sitting up to design solutions to ensure that we save women, we save the lives of women as well as their babies. And so I believe at the end of this workshop, we'll gain a lot of knowledge and skills that we will employ further in trying to improve the maternal and child health in the state. The participants have called for their commitment, dedications to get the entire knowledge and skills that will be transferred in the course of this training, and for them to go back and ensure they work with it. We have full participants from all the relevant MDs in the state, including representatives from the communities, because we can't tackle maternal mortality without the community participation, ownership, and input. And so I believe they will carry the message, not only that the religious leaders are here too. We'll be passing this message in our mosques, in our churches, in women groups, in all professional associations, at the grassroots.
Some of the participants expressed their expectations from the workshop to bridge many barriers that contribute to deaths of women and children during childbirth.
Wannan shirin da gwamnati ta shirya gaskiya shiri ne mai muhimmanci sosai, wanda kuma zai taimaki rayuka, especially mata masu haihuwa. Saboda rayuka na salwanta ta wajen delivery section. Zan tara mutanenmu wanda za mu tabbatar musu da abin da aka koya mana, inda kowa zai tafi da rayuwar shi mu fita cikin wannan hatsarin.
We have a rate of those issues. So with this training, inshallah, we are going to the rate of maternal morbidity and mortality rate will be reduced by birth rate, because we have some lapses. And through this workshop that we are going to not educate us again on what we are going to do, what we are going to carry out during the training, and what the assessment that we are supposed to do in our various health facilities, so that we have the reduction of all these challenges that we do have.
The co-creation workshop will last for 5 days to equip participants in designing solutions and interventions to address the identified challenges through MAMI strategic framework. From Haskell Lowry in Mina, Zainab Halili Kobu reporting for NSTV News.